Bismillahirrahmanirrahim. My name is Kashif Saeed and the topic of presentation is fetal mummification of a 270 days fetus in a mare. His presentation was a 12-year-old primiparous Sally Frances mare was presented to the University of Pennsylvania New Bolton Center for Pregnancy Evaluation at approximately 350 days of gestation. The mare was initially examined 33 days prior to admission by the referring veterinarian at approximately 317 days of gestation, when premature mammary gland development was noted by the owner, and the veterinarian said the viability of fetus was not assessed by transabdominal ultrasonography, and the veterinarian suggests some medicines that includes trimethoprim sulfa and alternogous administration for suspected placentitis. The mammary gland development regressed and no signs of premature labor were observed. And the second transrectal and transabdominal ultrasonography's examination suggests no fetal fluid were visible. The fetus has no heartbeat and there was no fetal movement. On presentation, the mare was bright and alert with all vital parameters within normal limits. The mare had no vaginal discharge, a slightly developed mammary gland. Hyperechoic structure consistent with fetal bone were visualized. Bony protuberances of the fetus were easily palpable through the wall of the uterus. And the treatment suggested by the Pennsylvania State University was a transvaginal manual delivery of the fetus was attempted. The cervix was initially closed and one hand was intrigued into the cervix, and a solution of methyl cellulose, lubricant and water was pumped into the uterus around the fetus. The cervix failed to fully dilate, and then the decision for cesarean section was made. And for cesarean section, anesthesia given to the mare was pre-medicated with 0.5 mg per kg salicylate intravenously, induced with 2.2 mg per kg ketamine intravenously, and 0.05 mg per kg midazolam intravenously. Anesthesia was maintained with isoflurane. The fetus was removed through a midline laparotomy incision. The fetus was female and weighed 17 kg with a crown rump length of 86 cm, suggesting that the fetus died around 270 days of gestation. There was no malodorous exudate or fetal maceration suggestive of active infection. The presentation position and posture was confirmed as per vaginal assessment. Outcome. The palpation and ultrasonography per rectum 48 hours after surgery revealed that the left ovary contained a corpus luteum and multiple small follicles less than 20 mm in diameter. The right ovary contained multiple small follicles. It was recommended the mare be kept on stall rest for 1 month, then turned out in a small paddock for 1 month before being turned out with a group of brood mares. Discussion. Fetal mummification of a singleton fetus or fetal maceration are rarely reported in the mare. Without a functioning fetoplacental unit, a fetus is generally aborted shortly after death before mummification occurs. In mares carrying a singleton fetal mummy, alternogous administration is thought to cause retention of dead fetus. There are several case reports in the literature. Many pregnant mares administered alternogous abort shortly after the fetus dies. A second group of case report involved early fetal death. None of the mare were administered alternogous. There is one case report that attributes fetal mummification to a congenitally short uterine body in a mare administered alternogous. A mummified fetus that appeared to be 80 to 90 days of age based on crown to rump length was aborted at 273 days of gestation. A 15-year-old mare was evaluated at 375 days gestation for vaginal discharge and a history of abdominal discomfort 17 days prior to admission. The mare had retained a dead fetus that could not be removed transvaginally due to the size of fetus and inelasticity of uterine wall. At term, partially mummified fetus was removed via caesarean section. The fetus was in transverse position and had never engaged in the cervix. The learning points from this case were late-term fetal death and mummification is possible in the mare without any systemic signs of illness. Second one was caesarean section is a viable option to deliver a large mummified fetus when the cervix is not fully dilated and the uterus is non-compliant.